So this leads to the third question about eating disorders, which are often misunderstood and stigmatized. So, how can therapy play a crucial role in treating eating disorders, and what strategies do you employ to help clients develop healthier relationship with food and their bodies?
Well, it's interesting that you brought up the topic of eating disorders because this is one of the most common and leading causes of mental health distress caused in young adults and adolescents during the pandemic, which was not too long ago. I'm sure you must have like known at least one person in your acquaintances or maybe in your family who a young person who has struggled with eating disorders. So with eating disorders, it's more of an integrative approach that helps. Uh, Usually, it is again cognitive behavior therapy because it helps you understand the thought process from where you're coming from, and also it heals those underlying challenges and teaches valuable skills to the person, to that young person or anyone with an eating disorder. It teaches them valuable skills to help them navigate for the next couple of years, because eating disorder, eat food is something we eat every day, right? And you're not going to have therapy for the rest of your life, but you need to learn and pick up those skills to be able to keep yourself safe and not to struggle in the future. So by integrative approach, I mean therapy, which could be CBT, which could be DBT as well, dialectical behavior therapy. And along with that, you need nutritional counseling, you might need some medical intervention. And a big part, if we are dealing with a young adult, is to involve the parents or the caregivers.
Hmm. And what about like people who have recently gone through a major life change, or moved to Canada? What happens is that you see that the prices for fruits, vegetables is so high. Not high is the right word, increasing compared to junk. Wherein you get it for like $1 or $2. And I'm asking this question from the perspective of an international student who has to manage finances. And the first thing that we think about, because I was also one of them, is to cut down on food expenses, because that's the only thing that you can control at the moment, compared to the increase in rent or your travel. I mean, your commute to and from college and work. Um, you know, Grabbing a pack of chips uh, looks convenient, easy, and inexpensive compared to having fruits, even though we know that, having fruits is something that would lead to a long-term benefit. So how could anyone watching this video navigate through this challenges?
That's one of the harsh realities with inflation and recent hikes in price of specially produced fresh produce. It's always been the case in Canada, but more recently so that fresh produce is way expensive. It's sometimes it's comparable to price of meat or fish or like other meat products. Now, for people who follow a vegetarian diet or who are vegans, of course, meat is not an option, but they still need their nutritional needs to be met. Now, for that, I would say the nutritional counseling and also a therapist can help them make wiser choices, healthier choices. There, now I'm talking not from the perspective of a therapist, but from someone who is working in the field of social work as well. Now, there are other options like food banks, which are more affordable. It might, for an international student, especially of someone of South Asian origin like myself, it might be a little stigmatized that, should I go to a food bank? How would that look? How does it feel? It's for the needy people. But looking at the reality, you got to do what you got to do to sustain yourself and keep yourself healthy. So just making healthier choices, being mindful, but nutrition is something you just cannot compromise on. So it is a difficult question to answer, but you will have to find out ways, and that's where the therapist is going to help you navigate to find uh, either solutions or reasonable ways out of this